Structures passing over the wrist joint and into the hand are of concern for wrist joint injury. For example, when the wrist joint is moved repeatedly in the same way or used with sustained pressure, the tendons are likely to become swollen. This swelling can impinge on and compress the median nerve. You might recognize these symptoms as carpal tunnel syndrome. Keeping the flexor muscles of the forearm relaxed and the wrist joint in neutral alignment as much as possible is the best way to avoid swelling and impingement. Therapists typically use movements allowed by the wrist joint such as ulnar deviation, radial deviation, flexion, and extension habitually when performing manual therapy. When possible, avoid radial and ulnar deviation by keeping your wrist in a neutral position to help maintain the strength of your hand. When performing a gliding stroke, avoid initiating the stroke using deviation. Begin the stroke using a neutral wrist joint and follow through with your properly aligned joint. Sustained pressure in the flexed or extended position puts tremendous stress on the structures of the wrist joint and on the flexor and extensor muscles of the forearm. Decreasing the angle of the wrist joint is the best strategy to avoid the problems associated with flexion and extension of that joint.